Hi there, my name is Isabelle Lian and I use she, her pronouns. I'm currently a senior majoring in neuroscience and minoring in the School of Liberal Arts Management minor. So I've been with the Reproductive Rights and Reproductive Health Internship and Planned Parenthood Gulf Coast PPGC for the past 3 years. And it's definitely been one of my most formative experiences here at Tulane. A lot has shifted with the COVID-19 pandemic, and yet the support that I received from this group has remained a constant, something that I'm very grateful for. I'm so excited to share with y'all a little more about my work with Planned Parenthood this past semester. All right. So, the bulk of my work this fall centered around advocacy and organizing around the 2020 November election. The election was a hot topic across the country, and for good reason. For many, eyes were focused on the presidential election, but we were also working against the passing of Amendment 1. The amendment on the table would add a clause to Article 1 of the Louisiana Constitution stating, to protect human life, nothing in this Constitution shall be construed to secure or protect a right to abortion or require the funding of abortion. Article 1 at that point did not explicitly mention access to reproductive health care or sexual education. The addition of anti abortion language to the Louisiana Constitution carried much weight, including banning abortion without exception. That includes cases of rape, incest, threats to physical and mental health, prohibiting any public funding for abortion, and threatening to criminalize physicians who provide patients with abortions. To combat this amendment, some points of advocacy that I worked on this term were voter registration week, a phone banking, tabling event data entry, and researching prior legislation that has limited abortion access in the state. So one of the core issues that we faced was how to reach out and engage our PPGC community given the restrictions on face-to-face events. With Voter Registration Day in September, I designed a Voter Registration Week challenge. Each day had an interactive event related to voting. Completion of each day was an entry to a Planned Parenthood swag raffle, which would hopefully engage people even more. The main goal was to encourage personal research and self-education on the intersections between reproductive justice and voting rights, mail-in voting, the history of voting in the US, Amendment 1, while also engaging each participant's personal communities, friends, and family through social media and personal invites. I scattered in some days of action to encourage support on social media platforms as well. And this is the graphic that I made for voter registration week here. So closer to election day, Planned Parenthood teamed up with Louisiana for Personal Freedoms to reach 50,000 BIPOC voters across Louisiana and spread the word about voting no on Amendment 1. To reach our goal, we recruited many volunteers to join in on our phone banking sessions, and I was able to host a phone banking party over Zoom to train volunteers about the mission, the script, and how to navigate the phone banking database. In addition, I engaged in some tabling and community outreach alongside my fellow intern Sophie. And so we tabled together on Tulane's campus in partnership with Vote No on Amendment 1, while we are also handing out PPGC swag. We were able to help explain what Amendment 1 meant for reproductive rights in Louisiana, as well as encourage our peers to get out to vote. After community events like tabling or voter registration, PPGC uses VAN, the Voter Action Network, to track our progress and reach so that the organization can easily see where goals are being met. So after events like these, I would input these events into that data entry system. Planned Parenthood has also organized several informational town halls to spread the word about Amendment 1. In preparation for those, I researched Louisiana's history of abortion restrictions, of which my past legislative data work actually helped very significantly. So between 1997 and 2020, I found that at least 104 anti-abortion laws or resolutions were introduced in the legislature. In 2006, Act 467, the first of many trigger laws, was proposed to prohibit abortion in the event that Roe v. Wade is ever overturned. A person who performs an abortion would then face potential jail time and large fines. House Bill 888 of 2010 required that an ultrasound be performed 2 hours before an abortion. Further restrictions included biased counseling bills, which required a patient to first receive a state-mandated lecture that details characteristics of the fetus, lists adoption agencies and crisis pregnancy centers, and that adoptive parents may pay costs of childcare. And all of these bills, not to mention the recent ones from the summer of 2019, the current legislative session, and now with the passing of Amendment 1, have all created a very critical situation here in Louisiana. And that makes it even more essential that we continue to fight back. I attended a Zoom lecture a bit ago through this internship and thought that this graphic from the Mancher Institute does a really great job of showing the aggressive legislative battles against abortion in Louisiana in comparison to other states. The sheer number of restrictions from legislation have severely limited access to reproductive health services and are now beginning to enter the Louisiana Constitution. It's also very important to remember that our work does make a difference. In New Orleans alone, 75% voted no to Amendment 1. In Baton Rouge, 50% voted no, and that was the leading vote in that parish. Ultimately, over 775,000 voters in Louisiana chose to defend abortion access. Professionally, I've also noticed a lot of things have begun to click for me with this internship. I actively started to use a writing agenda on Google Docs, which helped remind me of the tasks that I had at hand, while also integrating prior experience into newer ideas. Whenever I felt somewhat lost in planning, this Google Doc helped center me. Also, through productive weekly meetings with my lovely supervisor, Kristen, we were able to brainstorm creative ideas to engage the community in our work. In that same vein, I'm so appreciative of the supportive environment of this internship. And without it, I wouldn't have been able to develop as much confidence in my ideas and perspectives. This confidence has helped me initiate more effective conversations and tackle problems head on. In not only this internship, but in other aspects of my life as well. I'm so grateful to have had the space to grow as a leader and as a woman of color. So thank you so much, and I just wanted to give a big shout out to Kristen Emmett, Dr. Claire Daniel, the Newcomb Institute, the Donna and Richard Esteves Fund for Reproductive Rights and Reproductive Health, and Planned Parenthood Gulf Coast. Thank you so much.